What are the critical considerations when selecting a shampoo for a dog with sensitive skin, and how should the grooming process be adjusted to prevent further irritation? Answer: when selecting a shampoo for a dog with sensitive skin, consider the following ingredients. Choose hypoallergenic, sulfate-free, and fragrance-free products. Look for shampoos containing soothing agents like oatmeal, aloe vera, or chamomile. pH balance. Dog skin has a neutral pH around 7, unlike humans, whose skin is more acidic. Ensure the shampoo is pH balanced for dogs' medical needs. If the dog has an underlying skin condition, e.g., dermatitis, use of vet-recommended medicated shampoo. Grooming process adjustments. Use lukewarm water to avoid irritating the skin. Gently massage the shampoo into the coat without scrubbing aggressively. Rinse thoroughly to avoid residue that may exacerbate sensitivity. Pat dry with a soft towel instead of vigorous rubbing, and avoid hairdryers unless on a low, cool setting. Sophia is a veterinary assistant preparing to transport a group of cats from a shelter to a new adoption center. The trip will take approximately 5 hours, and the cats have varied temperaments, including one with a history of severe travel anxiety. What steps should Sophia take to comply with transport regulations and minimize stress for the cats during the trip? Answer: Sophia should compliance with regulations. Ensure that carriers meet the Australian animal welfare standards for transport. Each carrier must provide adequate ventilation, space for the cats to turn around, and secure locking mechanisms. Verify that all animals are vaccinated and have health clearance certificates if crossing state borders. Pre-transport preparations. Use separate carriers for each cat to avoid territorial disputes. Familiarize the anxious cat with its carrier by introducing it several days before the trip with positive reinforcement, e.g., treats or toys. Avoid feeding the cats within 2-3 hours of the journey to reduce the risk of nausea. During the journey, place carriers securely in the vehicle to prevent movement. Play calming music or use feline pheromone sprays to ease anxiety. Check on the cats periodically without opening the carriers to ensure they are comfortable and secure. Post-transport care. Allow the cats to acclimate to their new environment in a quiet room before releasing them into shared spaces. Monitor them for signs of stress or dehydration and provide water immediately. Relevant rules. The Australian Animal Welfare Standards for land transport emphasize minimizing stress and ensuring safety during relocation. Non-compliance can result in penalties under state or territory animal protection laws. Why is regular ear cleaning essential for dogs with floppy ears, and what are the risks associated with improper cleaning techniques? Answer: dogs with floppy ears, such as Cocker Spaniels, are prone to ear infections due to reduced airflow, which creates a moist environment ideal for bacteria and yeast growth. Benefits of regular cleaning: removes debris and wax buildup, reducing infection risks. Allows early detection of issues like redness, swelling, or foul odors. Risks of improper cleaning: using cotton swabs. Pushing debris further into the ear canal can lead to impaction or damage to the eardrum. Harsh solutions: using alcohol or hydrogen peroxide can irritate the sensitive ear tissues. Overcleaning, stripping the natural protective layer in the ears can increase vulnerability to infections. Correct technique: use a vet-approved ear cleaner. Apply the solution to the ear canal, massage the base of the ear, and wipe away excess with a cotton pad. Avoid inserting any object deep into the ear canal. How would you differentiate between a parasitic skin condition and an allergic dermatitis in a dog, and what are the appropriate steps to manage each? Answer: parasitic skin condition. Symptoms: hair loss in patches, excessive scratching, presence of fleas, ticks or mites, and scabs or crusting. Management: conduct a skin scrape to confirm the diagnosis. Treat with prescribed antiparasitic medication, e.g., selamectin or acyclazolines. Clean the environment to prevent reinfestation. Allergic dermatitis. Symptoms: generalized redness, itching, frequent ear infections, and licking of paws. May occur seasonally or due to specific allergens, e.g., food or environmental. Management: identify allergens through an elimination diet or allergy testing. Provide antihistamines or corticosteroids as prescribed. Use hypoallergenic shampoos and topical treatments for symptomatic relief. Relevant rules. Under the Australian Code of Practice for Animal Health, veterinarians must perform thorough diagnostics before treatment to ensure effective care and minimize animal suffering. What factors should be considered when selecting grooming tools for a double-coated dog, and why is undercoat care essential? Answer: factors to consider: coat type. Choose tools like undercoat rakes or just shedding combs to manage thick undercoats effectively. Tool material. Opt for high-quality stainless steel tools to prevent rust and ensure durability. Comfort. Ensure tools have ergonomic handles to prevent fatigue during grooming. Importance of undercoat care. Double-coated dogs, such as huskies, shed their undercoats seasonally. Failing to remove loose undercoat hair can lead to matting, skin irritation, and overheating. Relevant guidelines. The Australian Animal Welfare Standards emphasize using appropriate grooming tools to ensure animal comfort and prevent harm. What are the key steps to monitor an animal's health after a long-distance transport, and why are these steps crucial? Answer. Key steps. Hydration check. Ensure the animal drinks water promptly to prevent dehydration caused by stress or prolonged travel. Behavioral observation. Monitor for signs of stress, such as pacing, excessive vocalization, or aggression. Note any unusual lethargy or withdrawal, which may indicate underlying issues. Physical examination. Look for injuries, abnormal discharge, or signs of heat stress, such as excessive panting or drooling. Feeding. Offer food only after the animal is calm to avoid gastrointestinal distress. Importance. Stress from transport can compromise immune function, making animals more susceptible to illness. Early detection of issues allows for prompt intervention, improving animal welfare. Relevant guidelines. The Australian Animal Welfare Standards and Guidelines mandate monitoring transported animals post-arrival to ensure they have not suffered harm or undue stress during transit. Mr. Patel is relocating his pet rabbit, Snowball, to a new home several hours away. Snowball is highly sensitive to changes in her environment and has shown stress symptoms during previous short trips, including refusing food and thumping loudly. How should Mr. Patel prepare and execute the relocation to minimize Snowball's stress? Answer. Preparation. Climatization. Gradually introduce Snowball to the carrier in a calm, quiet environment using treats and positive reinforcement. Comfort. Line the carrier with soft bedding and add familiar items such as a blanket or toy to provide a sense of security. Environment control. Maintain a consistent temperature and avoid direct sunlight during transport. Noise reduction. Minimize loud noises by driving smoothly and avoiding sudden stops or sharp turns. Breaks. If the journey exceeds 2 hours, stop in a quiet area to check on Snowball, ensuring she remains calm and hydrated. Post-relocation. Place Snowball in a quiet room with her usual cage and supplies to allow her to adjust gradually to her new environment. Monitor her for signs of stress, such as hiding or reduced appetite, and provide support as needed. Why is it important to address tartar buildup in dogs, and what are the potential systemic health implications if left untreated? Answer. Importance of addressing tartar. Prevents periodontal disease, which causes pain, tooth loss, and difficulty eating. Reduces bad breath. Halitosis, a common sign of oral health issues. Potential systemic health implications. Bacterial spread. Oral bacteria can enter the bloodstream, leading to systemic infections. Bacteremia. Organ damage. Prolonged oral infections are linked to heart, kidney, and liver diseases due to bacterial colonization in these organs. Preventive measures. Regular brushing with canine-specific toothpaste, providing dental chews or toys designed to reduce plaque. Scheduling professional dental cleanings with a veterinarian. Relevant rules. The Australian Veterinary Association promotes regular dental checkups as part of comprehensive animal health care. A client complains that their dog becomes agitated during nail trimming. What techniques and tools should you recommend to ensure the process is safe and stress-free? Answer. Techniques. Desensitization. Gradually introduce the dog to the nail clippers by associating them with treats and positive experiences. Proper handling. Hold the paw gently but firmly to prevent sudden movements. Avoid cutting nails too short to prevent hitting the quick, which causes pain and bleeding. Tools. Nail grinder. An alternative to clippers for smoother edges and a quieter process. Styptic powder. Essential for stopping bleeding in case of accidental quick cuts. Stress reduction. Work in a calm environment with minimal distractions. Take breaks if the dog shows signs of stress, such as excessive panting or attempting to escape. Relevant guidelines. The Australian Code of Practice for Animal Welfare emphasises using humane methods and reducing distress during routine care procedures. A dog presents with excessive itching, redness around the belly, and small pustules. The owner suspects a food allergy. How should this condition be assessed and managed? Answer. Assessment. Detailed history. Obtain information about the dog's diet, environment, and recent exposure to potential allergens. Diagnostic tests. Perform skin scrapings to rule out parasitic infections and conduct an elimination diet to identify food allergens. Management. Dietary change. Transition the dog to a hypoallergenic or novel protein diet for 8-2 weeks under veterinary supervision. Symptomatic treatment. Use prescribed antihistamines, corticosteroids, or medicated shampoos to relieve itching. Environmental management. Ensure the dog's environment is free from potential irritants like harsh cleaning chemicals. Relevant guidelines. Veterinarians in Australia must adhere to evidence-based diagnostic protocols before initiating treatment, ensuring accurate and effective management of animal health issues. Explain the critical steps involved in the sterilization of surgical instruments and how improper sterilization can impact both animal and human health in a veterinary clinic. Answer. Sterilization is crucial in preventing cross-contamination and infections during surgical procedures. The key steps include cleaning, pre-clean instruments to remove organic material using enzymatic solutions or detergents, disinfection, soak instruments in a high-level disinfectant, inspection, examine instruments for damage or retained debris, sterilization process, use an autoclave preferred method at 120 UNIC 134D, GC under pressure for a specific time, ensuring all pathogens, including spores, are eradicated, storage. Store sterilized instruments in a sterile environment to maintain their sterility. Improper sterilization can result in transmission of infections like tetanus or leptospirosis to animals, zoonotic diseases being transferred to humans, legal repercussions under workplace health and safety regulations, e.g., Australian Work Health and Safety Act 2011. Emma's volunteering at a wildlife rehabilitation centre when a juvenile kangaroo is brought in after being hit by a car. The animal shows signs of shock and has a suspected broken leg. What immediate actions should Emma take, and what are the ethical considerations? Answer. Emma should assess and stabilize. Keep the kangaroo calm by placing it in a quiet, warm environment. Dress shock by hydrating via oral or IV fluids. If trained to do so, immobilize the limb. Apply a temporary splint to prevent further damage. Consult a veterinarian. Quickly transfer the animal to a qualified wildlife veterinarian for diagnostic imaging and advanced care. Ethical considerations. Follow the Code of Practice for Injured Wildlife, Australian state guidelines, ensuring the animal's welfare and minimizing stress. Evaluate whether the injury is treatable or if euthanasia is necessary to prevent prolonged suffering in consultation with the veterinarian. Describe how to safely restrain a medium-sized dog for a blood draw and explain the potential consequences of improper restraint. Answer. To safely restrain a dog for a blood draw. Positioning. Place the dog in lateral recumbency lying on its side. Restraint. Hold the dog's foreleg to expose the cephalic vein. Avoid excessive force to prevent injury or stress. Safety. Use a muzzle if the dog exhibits aggressive tendencies. Consequences of improper restraint: injury to the animal, e.g., muscle strain or vein damage, increased stress levels leading to elevated cortisol, which can affect blood test results, risk of bites or scratches, violating the Australian Work Health and Safety Act 2011, adhering to the Australian Veterinary Nurse and Technician Code of Conduct ensures both animal welfare and handler safety. List and explain the critical parameters to monitor during an animal's recovery from anesthesia and the potential risks if these are not monitored effectively. Answer. Critical parameters. Respiratory rate and pattern. Monitor for normal, steady breathing. Normalities may indicate airway obstruction or anesthetic complications. Heart rate and pulse quality. A weak or rapid pulse can signal shock or hypotension. Temperature. Hypothermia is common post-anesthesia use warming devices as necessary. Pain levels. Assess using pain scales and administer analgesics as prescribed. Consciousness and reflexes. Ensure the animal regains alertness progressively. Risks of ineffective monitoring. Hypoventilation leading to hypoxia. Cardiovascular collapse. Prolonged hypothermia causing metabolic issues. Veterinary staff must follow the guidelines for anesthetic recovery monitoring as outlined by the Australian Veterinary Association of a Discuss the key considerations for housing and enrichment for captive koalas to ensure their physical and psychological well-being. Answer. Key considerations. Housing. Provide spacious enclosures with natural foliage for climbing. Ensure temperature control 18-dick, 26-dick and shelter from harsh weather. Diet. Supply fresh eucalyptus leaves from diverse species to mimic natural feeding habits. Enrichment. Include climbing structures and varied leaf placement to encourage natural behaviors. Minimize human interaction to reduce stress. Legal framework. Comply with the National Parks and Wildlife Act 1974 Australia and relevant animal welfare standards and guidelines. Improper care can lead to stereotypic behaviors, poor health, or breaches of legal and ethical obligations. A client insists on using an over-the-counter medication for their dog instead of the prescribed one. How should you handle this situation while maintaining professionalism and ensuring the animal's welfare? Answer. Steps to handle the situation. Educate. Explain the potential risks of using unapproved medications such as toxicity or ineffectiveness. Empathize. Acknowledge the client's concerns, e.g., cost, while emphasizing the prescribed treatment's necessity. Provide alternatives. Suggest cost-effective or generic options if available. Document the interaction. Record the conversation in the client's file. Refer to the Veterinary Practitioner Code of Conduct under the Australian Veterinary Surgeons Act, ensuring compliance with informed consent and animal welfare laws. What are the key steps involved in sterilizing surgical instruments, and why is this process critical for both animal and human health in a veterinary clinic? Answer. Sterilization of surgical instruments is vital to prevent cross-contamination, infections, and breaches of workplace safety laws. The process includes pre-cleaning. Instruments must be washed with enzymatic solutions or detergents to remove visible organic debris. Any remaining material can reduce the effectiveness of sterilization. Disinfection. Soak in a high-level disinfectant to reduce microbial load before sterilization. Inspection. Check instruments for cracks, wet, or retained debris to ensure their integrity. Sterilization. Use an autoclave to apply steam under pressure 120 UNIC 134D GC for the required time to kill all microorganisms including spores. Storage. Keep sterilized instruments in sealed, sterile packaging in a contamination-free area. Failure in sterilization can lead to infections in animals, such as sepsis, and the transmission of zoonotic diseases like leptospirosis to humans. Additionally, non-compliance with sterilization standards breaches the Australian Work Health and Safety Act 2011 and guidelines set by the Australian Veterinary Association. Liam, a volunteer at a wildlife centre, is presented with an orphaned baby possum that appears weak and dehydrated. What steps should Liam take to stabilise the possum, and what ethical and legal responsibilities must he consider? Answer. Liam should take the following steps. Immediate care. Place the possum in a quiet, warm environment to reduce stress. Gradually rehydrate the possum with a suitable electrolyte solution, ensuring proper hydration technique to avoid aspiration. Nutrition. Once hydrated, provide species-appropriate milk replacer in small, frequent amounts using a feeding syringe. Observation. Monitor for signs of hypoglycemia, hypothermia, or respiratory distress. Ethical responsibilities. Ensure the possum's care aligns with its best interest, avoiding prolonged suffering. Follow the code of practice for wildlife rehabilitation, ensuring that the animal is handled minimally to preserve its ability to be released into the wild. Legal considerations. Possess the necessary permits under the National Parks and Wildlife Act 1974 Australia to handle and rehabilitate wildlife. Transfer the possum to an experienced wildlife carer or veterinarian if its condition worsens. Describe the process for safely restraining a large dog during an X-ray and the risks associated with improper restraint. Answer. Safely restraining a large dog for an X-ray involves positioning. Place the dog in the required position, e.g. lateral recumbency for abdominal X-rays. Use positioning aids like foam wedges to maintain stability. Restrain. One handler stabilizes the head and neck while another holds the lower body, ensuring firm but gentle control. If the dog is uncooperative, a mild sedative may be administered under veterinary supervision. Protective measures. Handlers must wear lead aprons and gloves to prevent radiation exposure and keep their hands out of the X-ray field. Risks of improper restraint. To the dog, stress injury, muscle strain, fractures, or poor quality X-rays leading to misdiagnosis. To handlers, increased risk of bites, scratches, or unnecessary radiation exposure. Handlers must follow workplace safety protocols under the Australian Radiation Protection and Nuclear Safety Act 1998 to protect themselves and ensure animal welfare. Proper training in handling techniques is essential to minimize risks. What are 3 key career pathways in animal studies, and what skills are required for each? Answer. Animal studies pave the way for diverse careers. Veterinary nurse. Veterinary nurses provide direct support to veterinarians. Their responsibilities include patient monitoring, administering treatments, and educating clients. Key skills are technical proficiency, skills like administering injections and monitoring anesthesia, empathy and communication, ensuring clients understand care plans, detail orientation, identifying subtle health changes to avoid complications. Animal behaviorist. Behaviorists address animal behavior issues. They work with pets, zoos, or conservation programs. Essential skills include behavior analysis, understanding behavioral causes, training techniques, applying humane training strategies, critical thinking, designing tailored solutions for specific issues. Wildlife rehabilitation specialist. Specialists treat injured wildlife, aiming for release back into the wild. Required skills include species knowledge, understanding specific dietary and medical needs, safe handling, managing animals to avoid stress and injury, collaboration, coordinating with conservation teams. Each path demands ethical adherence and ongoing education to meet evolving animal care standards. James manages a wildlife sanctuary. He discovers that the sanctuary's usual supplier sources feed from a farm linked to deforestation. What steps should James take to ensure sustainable sourcing? Answer: James should adopt practices aligned with ethical and environmental sustainability. Review supplier credentials. He should verify suppliers' environmental practices. Look for certifications like Rainforest Alliance or Fair Trade Certified. Source locally. By sourcing from local, sustainable farms, James reduces the environmental footprint associated with transport. Audit current suppliers. Conduct on-site audits to validate sustainable claims. This ensures that suppliers adhere to environmental protection standards like the Environmental Protection and Biodiversity Conservation Act. Establish sustainable sourcing policies. He should implement policies prioritizing eco-friendly suppliers, including contractual requirements for ethical practices. Engage staff and stakeholders. Training and discussions about ethical sourcing practices ensure everyone in the organization supports sustainability goals. These steps ensure compliance with environmental regulations and demonstrate the sanctuary's commitment to conservation efforts. Explain the importance of conducting an energy audit in an animal care facility and list 3 potential outcomes. Answer: an energy audit is essential for identifying inefficiencies and enhancing sustainability. It assesses how energy is consumed in areas like lighting, HVAC systems, and water heating. Key outcomes include reduced operational costs. Upgrading to energy-efficient systems like LED lighting or smart thermostats can cut energy bills significantly. Environmental benefits. Lowering energy consumption reduces the facility's carbon footprint, aligning with sustainability goals. Regulatory compliance. Adhering to energy efficiency standards outlined in regulations like the National Energy Conservation Act helps avoid penalties. By implementing audit recommendations, facilities can enhance both financial and environmental performance while setting a strong example of corporate social responsibility. What are the potential risks of poor task prioritization in an animal care setting? Answer: poor task prioritization in animal care poses significant risks to animals, staff, and the facility. These include delay in animal care. Critical health issues might go unnoticed or untreated, jeopardizing animal welfare. For example, failing to prioritize administering life-saving medications can lead to severe outcomes. Increased stress for staff. Mismanaged workloads create burnout, lowering efficiency and morale. Overburdened staff may also make errors such as mislabeling medications. Non-compliance with regulations. Missing deadlines for reports, such as those required under the Animal Welfare Act, can result in legal penalties and reputational damage. To mitigate these risks, staff should use structured methods, such as the Eisenhower matrix, to categorize and address urgent and important tasks first. Discuss the ethical implications of providing inaccurate information to a client about their pet's condition. Answer: providing inaccurate information breaches ethical principles, client trust, and professional standards. Breach of integrity. Professionals must uphold honesty. Giving false information undermines this core value. Harm to the animal. Inaccurate advice may delay treatment or worsen the pet's condition. For example, misleading a client about their pet's need for surgery could result in severe health deterioration. Legal consequences. Misrepresentation violates laws like the Veterinary Services Regulation Act and may lead to complaints, lawsuits, or disciplinary actions. Client distrust. Clients rely on accurate information for decision-making. Losing trust can damage the professional-client relationship and the facility's reputation. Veterinary staff must ensure all communications are truthful, evidence-based, and aligned with the Code of Professional Conduct for Animal Care Professionals. How can an understanding of pathology assist in early disease diagnosis in animals? Answer: pathology involves studying the causes and effects of diseases, enabling veterinarians to detect abnormalities in animals. Early diagnosis through pathology is vital for disease identification. Pathology provides insights into tissue changes, cell abnormalities, or organ dysfunction caused by diseases. Treatment planning. Early detection allows for timely interventions, improving outcomes. Preventive measures. Identifying patterns in pathology reports aids in preventing outbreaks. For example, identifying lesions during a necropsy can indicate parasitic infections, prompting immediate control measures. Veterinarians rely on standards like the Australian Animal Pathology Guidelines to ensure accurate diagnosis. Sarah works at a wildlife rehabilitation centre. A koala admitted to the facility as visible signs of chlamydial infection, including conjunctivitis and urinary incontinence. What immediate steps should Sarah take to manage this case and prevent further spread? Answer: Sarah should isolate the koala, prevent contact with other animals to stop disease transmission, seek veterinary care, ensure the animal receives a definitive diagnosis and appropriate antibiotic treatment as per the Code of Practice for the Welfare of Wildlife, biosecurity measures, disinfect areas, wash hands thoroughly, and wear PPE when handling the koala, educate staff, inform staff about chlamydial infections and zoonotic risks, documentation and reporting, record the case and report it to local wildlife authorities if required by law. Failure to act responsibly could lead to legal repercussions under wildlife protection legislation and jeopardize the health of other animals. What are zoonotic diseases and why are they significant in veterinary practice? Answer: Zoonotic diseases are infections transmitted between animals and humans. Examples include rabies, a fatal viral disease transmitted through bites; toxoplasmosis, spread via contact with infected cat feces or contaminated soil; leptospirosis, caused by bacteria in animal urine, potentially leading to severe illness in humans. Significance in veterinary practice: public health protection, prevents disease transmission to humans; client education, informs pet owners about hygiene and preventive measures; legal responsibility, ensures compliance with laws like the Public Health and Wellbeing Act 2008. Veterinary staff must implement biosecurity measures and vaccination protocols to minimize zoonotic risks. Describe the ethical decision-making process when handling suspected animal cruelty cases. Answer: Addressing suspected animal cruelty requires ethical and legal considerations. Observe and document. Record all observations, including visible injuries, behavior, and environmental conditions. Report concerns. Notify the appropriate authority, e.g., SPCA or local animal welfare organization as per mandatory reporting laws in the Animal Welfare Act. Protect the animal. Ensure the animal's immediate safety, possibly arranging removal if warranted. Confidentiality. Maintain discretion to avoid compromising investigations. Veterinary professionals are bound by ethical guidelines to prioritize animal welfare while navigating legal frameworks. James, a veterinary technician, is treating a dog, Bella, diagnosed with leptospirosis. Bella's owner refuses hospitalization and demands at-home care to save costs. What should James do to manage the situation ethically? Answer: James should educate the owner, explain the severity of leptospirosis, zoonotic risks, and the necessity of hospitalization for isolation and intensive care. Propose alternatives. Offer cost-effective solutions, such as payment plans, to alleviate financial concerns. Document communication. Record all discussions, including the owner's refusal in accordance with veterinary guidelines. Prioritize public safety. If the owner persists, provide clear instructions on isolation and hygiene practices at home as per the World Organization for Animal Health (OIE) standards. Failure to address public health risks could lead to legal liabilities for the clinic and the owner. What biosecurity measures are essential in preventing the spread of infectious diseases in an animal care facility? Answer: Biosecurity measures are critical to contain infectious diseases. Key practices include isolation of infected animals, segregate sick animals to prevent disease spread, use of PPE, gloves, masks, and shoe covers reduce contamination risks, hygiene protocols, regular disinfection of facilities and equipment with a focus on high-contact surfaces, vaccination programs, ensure all animals are vaccinated according to industry guidelines, staff training, educate staff about early signs of disease and appropriate response measures, following the biosecurity guidelines for animal facilities minimizes outbreak risks and ensures compliance with the Animal Health Act 1985.